Hello, my name is Tammy Ngo, a first-year speech-language pathology graduate student at Western Kentucky University. This semester, I had the opportunity to evaluate, treat, and build a lasting friendship with a 2.5-year-old boy at the Communication Disorders Clinic. Because he could not be here, my little friend Jorge will sit in for his place. He was referred to the clinic by his mother for concerns regarding his speech development and speech sound production. The client has a history of repeated ear infections. Bilateral pressure equalization tubes were placed to relieve the excess fluid. Since then, the client has shown marked improvements with his hearing and is beginning to produce two-word combinations. Listed here are the goals of the initial assessment plan. The MacArthur Bates Communicative Development Inventory's Words and Gestures form was given to the client's parents to fill out to assess their knowledge of the client's language skills and to get an inventory of his vocabulary. The PLS-5 was administered to assess the client's receptive and expressive language skills. The GFTA-3 targets productions of sound in words and was administered to assess the client's articulation skills. His articulation and phonological skills were evaluated using the CAP-2. The client scored with the normal limits on the PLS-5 and GFTA-3. Test results from the CAP-2 revealed below average levels in articulation and phonological skills. The client has multiple phonological processes that are active. 7 of the 10 common phonological processes the young children exhibit is active in the client's speech. Following evaluation, treatment goals and objectives were developed. The goal is to improve the client's expressive language skills and to improve his speech sounds production. Play-based strategies such as expansion, modeling, sabotage, and visible but not reachable were used to elicit novel utterances of 2 or more words. The client was motivated by Cars, Trains, PJ Masks characters, and Eric Carle books, especially the Brown Bear book. To address language goals, I used children books and toys to engage in hands-on play-based activities. Some of the toys I used included the Lucky Ducks game, the car ramp, train set, Play-Doh, PJ Masks toys, and a play kitchen. I also utilized snack time to facilitate communication. The traditional articulation approach, along with play-based strategies, were used to teach P in the initial position of words. Activities used to target P include the Popping Pig game, articulation pop worksheets, bubbles, rice box, the If You Give a Pig a Pancake book, play kitchen, and minimal pairs flashcards P and B. To get the client to produce final sounds, I adapted toys, used final consonant deletion worksheets, and read to him children books with CBC words. Because the client was highly motivated by playing with the car ramp and the trains, I adapted those toys by adding flashcards to form the road and the train track. I used say prompts to elicit the target words on the flashcards as the car or train drove onto them. Brown Bear was incorporated into many of the sessions because of his special interest with it. The board game and interactive Velcro animal sheets were used to elicit final sounds and words by getting the client to say the animals in the book. A typical therapy session included an interactive book reading, 1 to 2 activities that targets final consonant deletion, 1 to 2 activities that targets the initial P, and an activity that targets language. Trains were always included in each session because the client has developed a consistent routine with the trains. Overall, the client responded well to treatment and has demonstrated positive outcomes. Modeling and whispering words with the initial P were the most successful strategies used to elicit the correct production of P. Phoneme segmentation, modeling, and emphasizing of the final sounds were strategies used to target the reduction of final consonants. The client responded well to these strategies and it increased his accuracy from 42% to 64%. Since the beginning of the semester, the client's mom, clinical supervisor, and I have observed an increase in the client's production of 2 or more word utterances. To promote carryover and generalization of skills, 4 transactional supports from Super Duper and the Hannon program were given to the client's family throughout the semester. I have been challenged with behavioral problems during the therapy sessions, but none were deviant from how a normal toddler would behave. Visual supports, such as a visual schedule board and a timer, were used to help the client remain on task. Social stories were also used to teach the client a specific behavior. The client demonstrated a difficult time transitioning out of the sessions. I have introduced the treasure box as a reward for his hard work. I use the first then prompt of first treasure box, then home to help the client make the connection that the session is coming to an end. I often use the first then prompt to get the client to remain on task, especially in the beginning when assessments were being administered. I have learned an abundant amount this semester. Specifically, I have learned how to effectively facilitate communication and elicit target words through play. I learned the importance of following the child's lead and learned how to deal with behavioral problems by using more direct language. I have had the greatest pleasure working with this client, and he is not just learning from me, but I am learning from him. Thank you.